I had a really interesting case of an individual of who we tested, and we picked up a significant genetic result. And at his family's Christmas event, he just started handing out little information cards that he had made going, you need to go to get tested. You need to go get tested. You need to go get tested.
Welcome to the Longevity Seat by Phenome Longevity. Today we have our genetic counselor, Huafrin Kotwal, who supports individuals with understanding genetic testing, inherited risks, and how results can be guided to more informed health and family planning decisions. So can you introduce yourself and tell us a little bit about your work?
So my name is Huafrin Kotwal. I'm a UK registered genetic counselor for nearly 7 years now. I have a subspecialty in cardiac genetics as well as reproductive genetics, and also not just from a clinical perspective, but also from a clinical research aspect as well, mainly variant interpretation or genetic result interpretation. And yeah, I'm really excited to be here and kind of make genetic testing and the concept of genetics more approachable and accessible for everyone.
And we're excited to have you. So to get started, what genetic counseling really means. So for someone hearing about it for the first time, what is genetic counseling and what does a genetic counselor do?
I think that's a really, really good question because not a lot of people know what we do or kind of what our purpose is. So in essence, you can think of genetic counselor as your or guide or advisor when you're undertaking genetic testing. Not because genetic testing itself is very, very complex, but there are also nuances or considerations or expectations that you might not be aware of. And we want to make sure that you're making the best decision for yourself, but the most informed decision before you undertake a genetic test as well. So that's really what a genetic counselor is. You can almost think of us as you have advisors for big life decisions, whether it's on a finance level or other kind of life-changing decisions. Genetic testing has to be thought of that way as well. So you can think of us as your advisors along that genetic journey, if you will.
Okay, and when someone comes to a genetic counseling session for the first time, what are they usually hoping to understand and what are they most nervous about?
So for me, when I have spoken with clients or patients who come for a genetic counseling session, they're trying to understand really what the testing can or cannot offer them and whether that fits in line with their expectations. Sometimes some people really want to know, will genetic testing answer this specific questions for me, or will genetic testing cover a certain umbrella of risk for me? And that's where we kind of really tailor the session to them as well. And I think a lot of people are really nervous about the implications for insurance, sometimes implications of their data being sold to third parties. And obviously there are very strict laws and strict information governance and data rules here in the UK and the EU as well. But we appreciate that that might not be applicable to every country as well. So it's about alleviating those fears or kind of being very clear as to how that data will be used, how it will be protected, and also about how it may be utilized in future research as well. A lot of people are also kind of concerned about that.
All right. And now going into understanding DNA and genetic risk, when we talk about reading someone's genome, what are we actually looking at and what can it tell us about their health?
So when we use words like genome or DNA, obviously DNA is something that's like thrown around quite commonly in TV shows and kind of crime shows. But when we stop and think about DNA, we have to look at it as a library. And I know that's probably an analogy that's been used a lot, but it's the most accurate one, which is why we probably refer to it so much. So if you think of a really vast library with lots of shelves and lots of books and different sections, you can think of your kind of DNA or your essential information being housed in a library. So you can think of DNA as pages and you can think of genome as a whole library. So that's what we mean. And basically, when your body wants to know or your cell wants to know what should I do, or how do I build this part of the body, or maintain this part of the body, or maintain this health, they refer to that section, to that specific shelf, to that specific book, and within that specific page. So you can see how genetic testing is highly specific, highly down to the individual sections, pages, even letters in that book as well.
Thank you.
And what can genetic testing not tell us, and why is it important to understand its limits?
I think it's really important to understand the limitations of genetic testing, because people come in with a lot of expectations when they hear the word genetics as well. So we really want to ensure that genetic testing is not going to be able to cover every known condition or every known specific change in the lettering of those pages of the analogy that we talked about earlier. The reason why it can't do that is because we don't know everything there is to know quite yet. I know people say, oh, we've mapped the human genome, we know everything there is to know. It's still a lot of noise. At the end of the day, it's about understanding what that noise means. So genetic testing is also very, very limited because we might have all the data in front of us. It's about the interpretation that is not quite to the level yet. We also have to appreciate that, there's, I don't know, however many, 7 billion or whatever in the population right now. There's so much variation that is normal and just unique to that population as well. So we also don't have a full understanding of that difference and variation yet as well. So there are limitations with genetic testing, and that is that it's, even though we say whole genome, it's looking as to what we know of today. That is going to improve in the future, and we might reach a point where we know everything. But I think we have to be very clear that these limitations still exist, and they may still well exist as well.
Okay, thank you.
And people often say your genes are your destiny. How much of that is true, and why is it not the full story?
Yeah, I think that's probably, when genetic conditions or inheriting conditions were first picked up, obviously the more severe conditions were picked up, obviously, because those were the most apparent. And our testing technology was also quite limited. So it could only pick up those really strongly kind of single gene associated with one condition. Obviously, now with the improvement of our genetic testing technologies, we're kind of picking up more kind of nuances or risk scores or smaller genetic results contributing as an aggregate to your overall risk of developing a health condition. So that's why I think we cannot say that anymore. Genetic testing is no longer your destiny. If it was, all of us would look the same, behave the same, and be affected with the same conditions. We are not sitting in isolation with our environment. Our environment interacts with us, what we put in our body, what we eat, how we work out, our environment, etc. And our lifestyle plays a really big role. So I don't think it's correct to say that anymore. And it's something that perhaps patients come in as well, that if we pick up a genetic result, that's it for life. No, we're just talking about chances and probabilities here when we talk about genetic testing.
So people often think genetic results are a simple yes or no answer. How much of genetic counseling is about risk, probability, and context?
Well, that's a great question, because that kind of, the previous point segues really well into that. And I think that's kind of the dogma that we're shifting away from as well, is that there are some conditions where it is a yes or no answer. If you do have a specific genetic result, it's almost certain that you will develop some aspect of the condition. But for the majority of conditions, that's still a chance or a probability. I know that there's a lot of the more common ones where we talk about cancer or the BRCA or BRCA gene, as it's more commonly referred to in the population. It's kind of couched as this like kind of fatalistic kind of development of cancer. And even though it's still a chance. It's a high chance, but it's not 100% chance. So it's really important when we talk about family planning, especially when we think about the future generation, is what is the chance of somebody developing the condition, but also what is the chance of somebody not developing the condition as well. So we have to present both things to expecting couples or expecting parents as well. And that really kind of helps make sure that we're not just having our horse blinders or just looking down one lens. We have to look at the whole picture as well. Ultimately, it comes down to risk perception, and there's no right or wrong answer when it comes to these things. And for some people, some figures might seem higher, some figures might seem lower, but it's important to present the whole information.
Okay. And now going off of that into family planning and carrier screening,
Mm-hmm.
when we talk about inherited conditions, what do families usually need to understand first?
I think we need to understand that if you're testing for a family history of an already known condition in your family, then that kind of helps, because it helps you have kind of first world or first-hand experience of what that condition is like for a person with that condition in the family, how it not only impacts the individual alone, but the wider family, people caring for them around them. If we're talking about general carrier testing and there's not much of an inherited condition in your family, then that's where we need to be clear that, again, even though carrier testing looks at all the really well-known common inherited conditions, it doesn't rule anything out that's really, really rare, something that's unique to your family. And it may not necessarily eliminate all risk. There's something which is what we call residual risk. So residual risk is what we call kind of leftover risk. If you're eating, I don't know, some food and there's always some leftovers, that's what we call residual risk. That's always left behind. Even with any type of genetic testing, there's always some residual risk there. A genetic condition can happen for the first time in an individual as they're growing as well. That's something that even if testing beforehand, it is not going to be able to tell you as well.
Okay, then. So carrier screening is often used by couples planning a family.
Mm-hmm.
What does it tell them, and how can it help them make a more informed decision?
Yeah, I think we first really need to understand is the couple's aim of doing the carrier testing. If they understand that, we just want to rule out the common conditions, and if we just want to make sure that we're starting our family planning from a well-informed place, then that's fine. If they're coming in with the expectation that carrier testing means that their child will, obviously nobody wishes it, but their child will never develop an inherited condition or never have an inherited condition, then perhaps they're not fully understanding the limitations of the carrier testing. As I said, it's more for common and well-studied and well-known conditions, and it may well miss out the more rarer ones. But even then, for the common ones, as we talked about, when a carrier testing report comes back as well, even if for both couples it's all fine and well, they've not really picked up anything, they still talk about population risk, because these conditions can just happen in a person in the general population anyway. And that's something that's outside of our control. So it's really about how much control they want over the process and how much they feel that carrier testing would afford them that control. And if they obviously are accepting that there's still some residual risk, then yeah, and that's something that they should go in with eyes wide open before they undergo the test.
Okay. And going off of that, can someone carry a genetic condition without having symptoms, and what does it actually mean to be a carrier?
Absolutely. So we're talking about two different things here slightly from that question. So you can be a carrier of a condition, and it just means that your chance of having that condition is just higher than the general population. So individually, you can be at a higher risk compared to somebody in the general population. And that's very common in cardiac conditions. And that's sometimes common in cancer conditions as well. It just means you might develop the condition. It might also mean that you may not ever develop the condition. Lots of people can walk around with significant genetic results predisposing them to a certain condition and never know about it because they never develop it. And that also brings us back to where genetics are not your destiny. It's not fatalistic, as we say. It just means that we just know that we just need to keep an eye on you because your chance is just slightly higher. You can almost think of it as like two runners in a race where one of the runners, his ankle is slightly sprained. It still means you can run the race, but it means that you'll probably maybe just be slower than the other person, or you might not complete the race altogether. So that's what we talk about. The second part is that where we talk about genetic conditions where two parents need to be carriers of a condition. So when you have that, they are healthy. They're not at a higher above general population risk of ever developing that condition. You need to have kind of be carrying both results from both parents to be affected with the condition. So that's what that carrier testing looks at for those specific types of conditions. So that what that means. Everybody is a carrier of something. If you were to test me, if you were to test everybody in the room here today, we are all bound to be carrying something. It's just because of, again, normal genetic change or variation.
Marvelous. Thank you.
And how can conditions be passed down through patterns like autosomal recessive or X-linked inheritance? And why is it important for families to understand?
Yeah, so the second one we talked about, that's what is commonly referred to as autosomal recessive. So that's when you need to have both parents being a carrier of the same condition. So obviously, parents share half of their genetic information with each child. So when we talk about autosomal recessive inheritance, if both parents are the carriers of the same condition, then there is a 1 in 4 or 25% chance that that individual will be affected with the condition. And there is a 50% chance that the child will just be a carrier, like one of their parents, perfectly healthy and fine. And there is another 25% chance that they will be, they won't be a carrier at all and completely healthy and fine. When we talk about X-linked inheritance, we're talking about conditions which are passed down through the X chromosome. So as we're probably already aware, females have 2 X chromosomes and males have an X and a Y. So there are conditions that affect the X chromosome. And because males only have 1 X, whereas females have 2, females are carriers, again, healthy carriers of the condition, whereas males are usually affected by that condition because they don't have a backup X copy as well. So that's also what carrier testing looks at as well, because sometimes some genders are more affected by certain conditions if they're passed down through what we call the X chromosome as well. So it's something that couples need to be aware of as well.
And now going into different types of genetic testing. So genetic testing is not just one thing. Can you explain the main types from carrier screening to testing inherited health risks?
Absolutely. So we've touched upon carrier testing quite a lot because I think that's probably one of the most common ones that come up. So we've touched a bit quite about that, and that, as we said, looked at autosomal recessive forms of conditions and also X-linked form of conditions. However, there are also types of genetic testing, which is what we call rare disease testing, which is where we look at conditions where we know if you have a particular family history of it, but you yourself are fine, but you are still concerned because there is a family history. It's quite natural to kind of enter these types of testing. So those will be really tailored to the type of condition present in your family as well. There are some rare diseases which kind of cover a bit of everything if the family history is not very specific. Or you can even think about whole genome sequencing. So where it looks at all the books in that library and it looks to see if there is any significant variation from the expected kind of what we would expect to see in those books or those pages. That one is quite extensive. And when you do genetic testing, the more you look at, the more uncertainty you pick up. The reason why is, as I said, our knowledge is really, really limited. So we are more likely than not to pick up results or pick up changes which we have no prior evidence of. And then it becomes really tricky to interpret, will this healthy individual develop that condition or not? So when we do genetic counseling, that's why the family history is so, so important. It really helps us tailor and personalize as to what test is the best fit for you. Because, I mean, if it were up to us, all of us would go off and have whole genome testing. But sometimes knowing all of that information and not being able to do anything with it because the evidence is not there is also unhelpful. And especially when we're talking about in a private context, putting that much money in to then not have a kind of an outcome or an actionable result is not something we would necessarily recommend as well.
And pharmacogenomics looks at how genes can affect medication response. Why does that matter in everyday healthcare?
It matters a lot because one of the biggest impacts of medication doing its job properly is the side effects. And obviously, that significantly affects the quality of life of an individual taking that medication. It's a serious matter to put someone on medication as well. So pharmacogenetics really helps us tailor the amount, the dosage, or suggesting a different type of a similar medication as well to make sure that it's effectively being used for that individual. You don't want to be prescribing somebody a drug where if they, can't process it properly, it doesn't do what it's supposed to do, but at the same time, it's still giving them the side effects. So it's all the downsides and none of the upsides. So pharmacogenetics really helps us, again, personalize and tailor it, which is something that is getting more traction, is entering the clinical space already. It's being used to kind of really guide, not just for cancer, but for cardiac medications as well.
Now, going into the human side of genetic results. So, genetic information is rarely just about one person. How do you help someone think about what to share with their family members?
It's hard because, again, we really encourage the person who's being tested first to kind of disseminate that information and be responsible for disseminating that information, which is a lot. It's a lot to put on an individual because, especially if they're healthy or unhealthy, they're thinking a lot about, they're trying to process the result for themselves, let alone to then go and start talking to family members saying, I had a really interesting case of an individual of who we tested and we picked up a significant genetic result. And at his family's Christmas event, he just started handing out kind of like little information cards that he had made going, you need to go to get tested. You need to go get tested. You need to go get tested. Is that the best way of doing it? That's up for debate, but yeah, it's really, really hard because I think we're going down a secondhand route. But I think that's why these kind of videos or kind of education resources are so important, because it helps patients talk to their families in a maybe less confronting or scary manner, because people hear genetics and they go, oh, I don't really want to know, and why would you tell me that, and I want to go get tested. So it's really about obviously explaining the importance of why genetic testing is needed without scaring them ultimately, or just kind of doing it in a very dramatic fashion, as it were. So I think it's really about a balancing act, isn't it? It's about saying that this is important, this is why it's important, but it's still ultimately up to you as to whether your relatives want to get genetically tested or not. And people have very, very strong ideas and strong values as to whether they not want to get genetic testing, and we have to respect that.
Okay, right.
And do people ever worry that genetic testing may tell them something they're not ready to know? And how do you support them through that?
Yeah, so when we talked about the really wider genetic testing, the whole genome testing, you might pick up this is what we call incidental results. So you might be getting this whole genome sequencing because you have a family history of cancer or another rare condition, and then another result comes up talking about a completely other different condition. Or I think the obviously the undertone in this question is that sometimes some types of genetic testing, especially if you're doing it as a trio, so between two parents and a child, it can really reveal non-paternity, or the fact that a child is not biologically related to the parent. We have had cases like that before. So we've had a individual where there is a known genetic result already in the family. They themselves have had genetic testing. They carry that same genetic result in the family. They've not told their child that they were adopted, but they still wanted them to have genetic testing because they didn't want to tell them that they were adopted. So then we enter this kind of thing of we're prescribing an unnecessary test, or we're, taking a part in this kind of duplicity or, coercion, or kind of enabling these kind of non-disclosure practices as well. So I think, it's important to make it clear that, these tests can reveal that. And we usually find that the longer you wait to tell somebody about something, the worse it gets. So I do think that it is scary, but that's why, again, pre-counseling is so important, is to make people aware that these are the kind of results, or these are the kind of unwanted information. And if you don't necessarily want that, then we really have to push and to say, do you really want to have genetic testing then in the first place? I think that's probably something not a lot of people want to think about. But if we're doing genetic testing to ultimately not share information with family members or not kind of have these difficult conversations, then perhaps this is a little bit controversial. But then we really do have to challenge, do you really want genetic testing then in the first place?
Now, from knowing to doing, a result is only useful if someone can act on it. So when someone learns they might have a higher genetic risk, what usually happens next?
Yeah, so it depends on the condition, to be very honest with you. But no matter what, there's lots of screening in place as well. There's lots of information and data as to, when screening is most impactful, as to whether they would, for certain genetic conditions, we might know, oh, you're not likely to develop anything until you're 30 years old or in this age range. Or no, we really need to start now. You really need to go be seen and reviewed by someone. So it really starts from the baseline there. So if you're healthy and well, and if a genetic result picks up that you are at a higher risk of something, then you would just go and have screening mostly. There are some kind of interventions that can be put in, particularly for cancer and such, which are prophylactic. So in sense, they reduce your risk of developing that condition. But it's really from the baseline is to be referred to a specialist to discuss these options, because they're specialists. They'll be able to guide you best and be able to reassure you that, look, we don't have to do anything for a while. We just need to keep an eye on it. Obviously, from a family perspective, if you have children or are planning to have children, then there are testing options available to you, through IVF or even during a pregnancy. Or if you already have children, then wider family testing can be arranged as well.
How can someone use genetic insight in a helpful way without becoming anxious or too focused on risk?
Yeah, I think again, I know it's probably saying the same thing, but this is where pre-counseling is so important, because we ask them to think about these types of scenarios, that how they would experience or how they would feel knowing that they are at risk or a carrier of a genetic condition. And it's really about starting them to think about these possibilities even before they enter the testing. So hopefully by the time, if they do receive such a result, they're a little bit in more of a refined headspace to do about it. The thing I find really, really useful for clients or patients is to get them to talk to other people that have been through this scenario. I feel like us as healthcare professionals, as geneticists, as medical professionals, clinicians, we're still quite removed from all of this. And I think that's where patients or charity support groups that have really been through this are really the best resource to kind of help people guide, or even their own similar family members that have been through the similar process as well. If that's not available, then that's where these similar patients or support groups are really, really useful, because it's just nice to know that you're not alone. And I think that's all really people want out of this process. And that's where a lot of these feelings of anxiety and a lot of these feelings of a lack of control over the situation, because you can't see a genetic result, right? It's still a very abstract concept when we talk about libraries and books and pages. It's still a very abstract concept. So talking to somebody makes you feel less alone, and medical professionals can only do so much. We need to recognize our limitations. And I think that's something that I frequently recommend and strongly advise to our patients.
So at Phenome Longevity, we look at genetics alongside microbiome testing, wearable tracking, lifestyle data, supplements, the Phenome app, and expert guidance. Why is it important to look at the whole picture rather than genetics alone?
I think it's because we've already touched upon this as well, is that genetics are not fatalistic. They're not your destiny. So, and I think that's always been the ethos in the medical or health sphere as well. You need to collect different data points to really build this kind of picture of what's happening in your body and in your health. We also talked about the environment impacting the genetics as well. This is why the wearables, this is why the blood tests and other data are so helpful and important, is because they tell us what is happening right now. They tell us about your health right now. Genetics just talks about this is what you were born with, and this is what may happen to you. Whereas the diagnostics or the scans are really about capturing your health right now. And that's why it's so important to marry the two to then really talk about your risk. And that's where, again, the personalization and really tailoring that information helps. So if you have all of that, then you have a really holistic approach to the patient and they feel kind of well supported from all data points. And I think that's really useful that Phenome does, is that they kind of understand the utility of that, and not just for that point of time, but in terms of longevity as well, over significant years as well. The more data you collect in these aspects for many, many, many years, the better the quality of the data is.
Yeah, it's good.
Okay, now just a few questions to close. What is the biggest misunderstanding about genetic testing that you wish more people understood?
There's quite a few, but I think we've covered them really, really well today. I think for me, the biggest misconception that I particularly struggle with is that patients really want more out of a genetic test result or a genetic answer that it's going to give to them. And as much as we can do to prepare the patient, I think some patients still end up sometimes disappointed in the process. A particular case stands out to me that there was this patient who I consented for diagnostic testing, and even though she already had the condition, and we picked up a significant genetic result, and usually people are very relieved to have an answer, but she was understandably quite disappointed because she felt like had she known this was the outcome or potential outcome, she wouldn't have done genetic testing. And that was something that really has stuck with me even all these years, because I think it's really important to, again, challenge or push people's wanting to know this information versus not wanting to know this information as well. So I do feel that I would just really get people to take a good hard look as to whether, when this result does come up, how would you really feel? And sometimes it's really difficult to say, but I think that's something I would want people to kind of really have a think about before they undertake genetic testing, or that misconception that, oh, I would be fine, or you may end up feeling ultimately disappointed as well.
And for someone who is curious about genetic testing but nervous about it, where would you tell them to start?
I guess I would try to unpack exactly what they're curious about with the genetic test. I think I would want to understand what aspects are they curious about, and then appropriately kind of guide them. And if they are nervous, what are they nervous about? Are they nervous about the insurance? Are they nervous about the waft of data that's going to come across? Are they nervous about finding something? Are they nervous about knowing paternity? Hopefully not, because that's a sticky situation at best. So I feel that it's really about unpacking and asking them to name those specific concerns and fears will really help guide me as to say, okay, I think, based on what you've told me and based on what you want, this is the most appropriate test for you. Or if they say, I kind of want to have this test, and I go, well, have you thought about what if this happens, or what if that happens with that result? And it's about really taking them through all those different scenarios to eventually for them to say, actually, you know what, I would be fine, or no, I would be not fine. Let's park genetic testing for now, or let's go down a more specific route or a more broader route as well. Hopefully that was okay.
No, your answers were so good. I was mesmerized.
Oh dear. Okay.
And you're natural too.
Yeah.
Oh God, I thought I was rambling.
No, I know.
No, I was like, shit, I'm rambling. Wrap it up, sis.
I learned so much too.